Over the past week, both through official government numbers and informal reports from healthcare workers, we've seen soaring numbers of COVID-19 cases. These numbers are the highest by far of any point in this pandemic. Even if a much smaller fraction of these cases produce severe illness compared to previous variants, the sheer volume of Omicron cases may overwhelm Alberta's healthcare system. So for that reason, I am today calling on Jason Kenney and the UCP to tell the truth to Albertans about the threat to our hospitals and everyone who relies on them that is posed by the Omicron variant. And this threat is not just speculation. Public health officials in Ontario have reached this conclusion and announced it publicly today. In a graphic they released today, officials from the Ontario government say, and I quote, projected COVID-19 related admissions are expected to result in capacity being overwhelmed, end quote. This is an extremely sobering statement from the largest province in Canada. In the worst case scenario, officials are projecting a 7-fold increase in COVID-related hospitalizations in just 2 weeks. Today, the Ford government did take steps to reduce transmission of the virus. So what does this mean then for Alberta and for Albertans and for Alberta's healthcare system? We know there are about 6,000 hospital beds across Alberta, but how many are there if a third of our healthcare workforce is away at any given time? Now, I know many of you may be asking whether Alberta should follow Ontario's lead in terms of the measures that were announced in that province today. And I don't know the answer to that question, and I can't until we have the facts about what the coming days and weeks will mean for our hospitals. These facts are available, and they should be shared with every Albertan. Last week, what we've seen even in the last week is that our hospitalization numbers are starting to go up, and it's not a blip. It's happened enough now over the last few days that what we've seen is a clear change in direction with respect to the rate of COVID hospitalization. With the onset of Omicron. So it's obviously not at the same level that we've seen in Ontario and Quebec because we all know they're a couple of weeks ahead of us, but we've changed direction. We've started moving up. Presumably AHS has projections that they can share with Albertans. And again, it's not for me to speculate UK, Ontario, Quebec, other places. It's for Albertans to look at the data that we have, data that is honestly shared with them by their government in an honest conversation. What we do know is that we're probably going to hear today that the number of people in Alberta in the hospital with COVID is over 400 as of today. And that's not as high as we've been in the past, but it is certainly much higher than we've been at other times. And we're going in the wrong direction. And so I am concerned with the kinds of projections that other provinces are making. And I want to know if we should assume that Alberta is somehow different, then I need for our government, for our leaders to tell Albertans why that is. Otherwise, we need to start learning from the lessons that we are seeing in other parts of the country and taking steps to protect our hospitals, protect people who need our hospitals, protect people who work in our hospitals.